The following program is presented by the Multiple Sclerosis Association of America and is made possible through the generous support of EMD Serono and Pfizer. Hello, and welcome to the Multiple Sclerosis Association of America's educational web video series, A Closer Look. The program you're watching is a closer look at managing MS fatigue. Joining us is Allison Shaddy, a medical clinical social worker and an expert in the field of counseling chronically ill patients and their families. She's the author of MS and Your Feelings, Handling the Ups and Downs of Multiple Sclerosis. Allison is also a person living with MS since her diagnosis in 1995. Allison, welcome to the program.
Thanks, Danny.
To begin with, for viewers who aren't familiar with you, can you give us a little information about your background and your experience with MS?
Well, sure. Just very briefly, I was working as a medical social worker over a decade ago, and actually was working with many MS patients at the time. And around that time, I also was diagnosed with the disease. Interestingly enough, I really was needing help myself to kind of deal with the emotional aspects and just all the other things that come with the diagnosis. I had difficulty actually finding a counselor and ended up specializing myself in counseling others with the disease, and that's what I've been doing for the last 10 years. So a lot of what I'm going to be talking about today comes both from a personal and a professional perspective.
Today we're talking about managing fatigue. How prevalent is fatigue with MS patients?
Well, it's a huge issue for folks with MS. In fact, about 78% of patients report dealing with fatigue. And they also, not only do they report dealing with fatigue, but they describe it as being one of the most disabling of all their MS symptoms.
Really?
And this is incredible when you think about the severity of symptoms and the wide range of symptoms. When they're describing that as the most disabling, I think it says a lot about the impact that fatigue is having on these patients' lives.
That's actually kind of surprising, like you said, given all the different symptoms they can have, that's the number one.
It is. It's interesting.
Wow. So with fatigue having such a huge impact on quality of life, I guess it would be really helpful to learn how to manage it.
Well, absolutely, and we're definitely going to talk about that for a little while today. But first, I really wanted to talk a bit about what it is that causes fatigue in MS patients. I think it's really important that they understand that. It is a very unique experience, the MS fatigue that people have, and it's unlike the kind of fatigue that the general population experiences.
How so?
Well, the way it's unique, basically, if someone without MS has fatigue, or even I remember before I was diagnosed, I could really push through that fatigue, and ignore it. People with MS can't do that, and this is kind of hard to understand, but if you imagine how you feel when you've had the flu, or maybe the way a chemotherapy patient might feel, where you are just bone dead, deep fatigue type of tired, that is what it feels like. It can't be pushed through. Some people may feel exhaustion much of the time. Other people might get tired really quickly after exerting themselves, but then they can bounce back. For some people, it's mental exertion that makes them tired. But it can really be impossible to know from day to day what our capabilities are going to be and how to pace ourselves throughout the day.
Right, so it makes it very hard to plan activities because you really don't know how you're going to feel on any given day.
Well, absolutely, and I think that this fluctuation in energy levels affects a patient in a lot of different ways. One of the things that we see happen is that there's a lot of loneliness and misunderstanding. Of course, if we can't determine or predict what our energy level is going to be, it's very hard for an employer or a family member to really understand, why we can do something earlier in the morning and then not be able to get off the couch later on in the afternoon.
Right.
I think patients also experience guilt because they're not able to do everything that they used to be able to do. So you find them kind of beating themselves up. As a result, they may try to push themselves past the point where they really should go, and then they end up feeling even more sick and more tired, and what happens is it takes a lot longer then for them to recover, versus pacing themselves throughout the day. So the other thing that we always have to do is kind of be planning ahead and also be prepared to change, according to how we're feeling.
Right. I would think that would be especially hard for parents, too, because when you have small children, you can't necessarily explain to them why mom can't do this today.
Well, that is so
It must
true.
be so sad and difficult for these patients.
Well, it is, and that's one of the reasons, and the good news is there are things we can do about it, and there are ways to pace ourselves, and that's one of the reasons it's so important to really learn how to manage that fatigue.
Mm-hmm. What causes fatigue in MS patients?
Well, that's a good question, and I'm glad you asked that because there are about 5 different primary reasons that MS patients experience fatigue, and I think it's really important that we understand why, not only to minimize the guilt ourselves, because if we understand the medical reasons that we're feeling this way, we're less likely to, sort of feel badly about the fact that we're tired.
Right.
And I also think it's really important that family members understand, because unfortunately sometimes patients are told they're just not trying hard enough or they're being lazy, and it really hurts to hear that.
Right.
And it's simply not true. So if we can talk about these 5 different causes, it'll give you, a better understanding, and then you'll get more understanding from other people.
Okay.
So let's just start. The first one is demyelination. Demyelination is basically what occurs when you're having an MS attack and the myelin sheath is eroded by the disease. Okay, so then what happens is there's scarring. That's the sclerosis part of the disease. And this scarring, I talk about it as if it were a speed bump, okay? It's something then that you have to get over for the information to go through the central nervous system. And that slows the process down. It slows our ability to do things down. It slows our ability to think or to get messages through the body. The other way I describe it is if you're going on a ski vacation and you're headed up the mountain and all of a sudden you find there's an avalanche, right? And it's blocked your path and you have to take a detour and go around another way. It takes a lot more energy, it takes a lot more time, and that's kind of what happens for people with MS. We're still able to do things, but we have to work a lot harder.
It's more complicated.
Exactly. So your brain works harder to kind of get the message through. There's actually been a study shown, it's a very simple thing, but they do an MRI and they show imaging of the brain while MS patients are just tapping their finger, a very simple activity, and it shows how much harder the brain has to work during just that simple activity. Yeah. Depression is another cause of fatigue. Fatigue from depression is often not resolved with rest, or it doesn't result from overactivity. The fatigue is coming from the depression itself. And so if the depression is treated with counseling and antidepressant medication, we'll also see that the fatigue from depression resolve itself.
Okay, so there's demyelination and depression. Are there any other factors that might contribute to fatigue?
Absolutely. One of the things that a lot of people don't think about, but the side effects from medication can also be a contributor. I tell clients, don't just assume that it's fatigue because you have MS and you have to live with it. Let's explore other possibilities. You may want to talk with your doctor about looking at, are you taking the lowest possible dose of medication? Experiment with your dosage to zero in on your best therapeutic level. Taking your medication in a different time of day. For instance, if you notice it says may cause drowsiness and you're taking the pill in the morning, talk to your doctor. Would it be okay if you take that in the evening? You may see a huge difference.
A very simple thing that might completely change your life.
Well, absolutely. And there may be other things you can do besides medication for some of the things you're treating, like exercise or stretching or physical therapy. So all these things are worth exploring with your physician.
Okay.
Pain is another issue. People don't necessarily make this association, but 20 to 50% of MS patients do experience some kind of pain. And if you think about it, when we're dealing with pain, that is an extremely draining experience. We use up a tremendous amount of energy to try to manage our pain and contain it. So effectively using a pain management technique like staying ahead of the pain, taking your medication when you're supposed to take it, that way we're much less likely to be drained from the pain and we'll feel better in general. The other thing is sleep disruption. Okay, many people with MS suffer from sleep disruption. I think it's about 3 times as likely for someone with MS to have something like insomnia or sleep disruption, and there's several reasons for that. 1, overactive bladder. Many of us have to get up several times during the night. 2, there's muscle spasms. That's a very common thing in the legs that can keep you up. Another thing is if we're napping during the day or we're not being very active, then it could be hard to go to sleep. The other thing is insomnia, which is another very common problem. So the good news is there are things we can do about these issues. Number one, if you have bladder control issues, number one, there are medications like Detrol. You know, you hear the gotta go commercials. Another client of mine came up with the clever idea of putting a bedside commode right by her bed, and it doesn't sound very attractive, but she was able to then go right back to sleep after having to get up. You know, try to slow down on fluids and what have you before sleep, you know, maybe a couple hours ahead of time. If you have to, use a sleep aid. Talk to your doctor, see if it's appropriate. But for some patients, it's really more important that they get a good night's sleep so that they feel refreshed during the day. But any of these things, you know, you want to talk to your doctor about and explore with them. The final note on that in terms of napping or resting, if you are napping, you'd want to do it earlier in the day, maybe before 2 o'clock, so that, you know, you haven't just taken a nap before you try to go to bed at night.
What else can patients do to manage their fatigue?
Well, one thing I want to say is that patients shouldn't just accept the fact that they, you know, have this fatigue and because they have MS they have to live with it. That's just not the case. There are many things that can be done to help them minimize the effect it has on their life. Unfortunately, though, physicians often overlook this symptom, and it is an MS symptom. They won't necessarily ask the patient about it. So as a patient, you've got to speak up. In fact, I'll give you a personal example. I was once talking to my neurologist about my fatigue, and I told her how it was difficult for me to even make it through dinner sitting up, that I would have to lay down in the middle of dinner. And she really minimized the experience, saying, well, you know, we're all getting older and it's normal to be tired. And I had to stop her and say, wait, this is not normal. So we've got to speak up and we've got to talk to our doctors about the different things that can be done to help us deal with this.
What treatments might a doctor recommend for fatigue?
That's a good question. I need to sort of, you know, state that really the FDA hasn't approved any medications specifically to treat MS fatigue, but that hasn't stopped doctors from kind of getting creative and coming up with a few different things that can help, such as Provigil, Silert, amantadine. These are all things that really can make a difference in patients' lives. I've had clients who have gotten on some of these medications who thought they might have to stop working, and once they started these medications, they were able to stay in the workforce. So these are huge. Sometimes antidepressants can help. You know, we mentioned earlier how depression can add to fatigue. We also talked a bit about spasticity, and baclofen can be prescribed for that, so that's a wonderful solution there. So there are things that can be done prescription-wise that can really help patients.
Good to know. And other than medications, what else can patients do to control fatigue?
Well, just like stress, we have to pay attention to what brings on our fatigue. So if you know what your fatigue triggers are, you'll better be able to prepare for it and maybe even to pace yourself throughout the day. So again, I like people to try to assign a fatigue level to each of their activities in the day. You'd want to sort of do a rating from 1 to 10, kind of the way you would rate maybe pain. So 1 would be, you know, it's not too taxing, and 10 would be pretty high on the scale. And there are several different things you might want to include in there, like socializing, exercising, shopping, traveling, driving. Assign each one of these things sort of a number so that you can kind of pinpoint, oh, this really, you know, does make me tired and I need to do this earlier in the day, or I need to pass this chore off to somebody else in my family. Maybe you wind up, you know, with work saying, I can work, but I need to work half a day, or I need to go to part-time, that sort of thing.
So making the connection between activities and fatigue level gives the patient a sense that they can manage their energy.
Absolutely.
Okay, we talked a little bit about napping earlier, but does that really help?
You just can't underestimate the value of napping. I'm not kidding. I'm a real advocate for this. And it doesn't work necessarily for everybody, but, you know, keep in mind, in other countries, they all take siestas, and, you know, it's a part of their daily life. And so, you know, I encourage people to at least experiment and try to introduce napping into your daily routine and see, you know, what results you can get out of it. I think that the approach to napping is really just as important as taking the nap itself. And just a few little tips for how to make, you know, your napping an effective and positive experience. One, you want to create a restful environment. You want to lower the noise, lower the lights. I have clients who even put a, you know, little sign out on the door to the kids, you know, don't come in unless there's bleeding, you know, that type of thing. It's going to be your quiet time that you protect. Turn the phone off. I think it can help people if they set an alarm clock so that they're not laying there worried that they're going to oversleep. So that takes the stress out of it. And even if you don't actually fall asleep, just the fact that you've got your eyes closed, and I mean not reading, not listening to music, anything.
Just resting.
Just resting, no extra stimulation. You're going to be refreshed. You're going to feel better. And it only has to be, 30 minutes to an hour if you can. That's all it takes, and it really gives you like a second wind for the rest of the day.
So napping is helpful, but how on earth do you fit that into your day?
Well, I know, it's hard.
That's the tough part, isn't it?
Yeah, it really is, and clients do get very creative about it, and I'll just throw out a few examples. I had one woman who, when the kids got home from school, she would put a video on, and she'd be with them in the room, but and I know this isn't exactly what we were talking about because there was stimulation, but for her with small kids, she could lay on the couch and close her eyes and sort of have the kids entertained. Another mom would go to school early, where she had to pick her kids up. She'd go about a half hour early and just lay back in the car before the kids got out of school. Some clients who are working, I tell them bring a pillow and a blanket, and at lunchtime go out to the car or go to a park and lay down. And again, just like the medications I was speaking of earlier, for some people just taking that nap at lunchtime, it's enabled them to stay in the workforce. So it's a powerful tool.
So what do you suggest for those days when there is just not time to nap?
Well, I know there are those days for sure. First of all, I think it helps if we can break things up during the day. Take just little small mini breaks where you're not having any stimulation. This might be the time where you would do a little meditation or deep breathing. There are actually 5 pretty simple things that you can add to your day that will really help you to manage all of this. The first one, and you wouldn't believe how hard this is for some people, but accept help if it's offered. And this is really hard for all of us, I know. But one thing to keep in mind is that when people ask, how can I help? They really do want to help. And you're actually doing them a favor by giving them something that they can do. It makes them feel better, and it makes them feel like there's something that they can do. Try to prioritize your tasks. Do the most important things first so that if you do get too tired, at least you've gotten the things that had to be done out of the way. Learn to say no, and ask for a handicap parking sticker. And a lot of people think, oh, but I can walk, I don't need that. Well, number one, if you don't have to walk as far, that's an energy saver. Number two, for someone like myself, I have a handicap sticker, and I use it when it's really hot, because to spend just a minute walking from my car to the store in the heat exhausts me. So this is pretty helpful, and that kind of goes along with using adaptive devices as well. There are things like using a scooter. Most places like Walmart and what have you, they'll provide a scooter for people. You don't realize it, but just that walking around can really add to your fatigue. And if you use the scooter, maybe you can do more. Maybe you can go to 2 or 3 stores instead of just the one and have to go home and rest. We've talked about this before, but a lot of people always have like a TV or a radio on in the background. And again, that's taking energy for us to process that information, even if it's not a conscious level. So try to turn those things off when you're at home by yourself and just enjoy the quiet.
Yeah, because we're so overstimulated as a society.
Well, we are. And again, this is a disease, where the central nervous system isn't involved. And so anything we're doing that's asking, the central nervous system to work, it's expending energy. The other thing, if being with large groups is sometimes more taxing for people than small groups, so sometimes if you want to keep socializing, have lunch with just 1 or 2 girlfriends instead of trying to, do something in a large group of people. And if the restaurant, with the noise and crowd is too much for you, have them come over or do a picnic outside. Create just a more restful environment. You also want to make time for things that you enjoy doing. It's not all about getting stuff done. We feel energized when we're doing the things that we enjoy.
So in addition to these energy savers, are there other things like diet and exercise that patients should really pay attention to?
That is a huge question that comes up all the time for MS patients, and I think there's been a lot of information out there. I don't know if it's all been really great information, but people are always looking for that kind of magic diet that's going to solve everything, and I guess we all do that. What I have found is that there is no one diet for everyone. When I was first diagnosed, I, fell victim to this. I went on a no meat, no wheat, no sugar, no dairy diet, and I lost a lot of weight, but I didn't...
That's just no fun, though.
And no, it's no fun. It's not sustainable, and it didn't really do much for my MS symptoms. So what I started to do, though, is really look at how certain foods made me feel, and what I found for me personally is, eating protein throughout the day, trying to reduce my sugar, because I noticed I'd have peaks and valleys when I had a lot of sugar. And again, that's for me. Other people, may feel differently, but what I ask clients to do is pay attention to what food sort of feeds you and energizes you, and what food kind of makes you crash and burn. It's something that we have control over. The other important note here is that imagine you're carrying around a 20-pound weight in a backpack, what that feels like. When we're carrying around an extra 10 or 20 or 30 pounds, that is going to add to our fatigue. So trying to get yourself into, a good weight for your body is going to give you more energy. And if you really struggle with this, then I would encourage you to go to a nutritionist, and they can help you really kind of, target a plan that makes sense for you personally.
So diet obviously plays a really big role in energy. What about the exercise component?
Well, exercise really does play a role as well, and some people might find this counterintuitive, but exercise actually increases energy. It doesn't decrease it, and it also helps to reduce stress. Unfortunately, not too long ago, physical activity was kind of discouraged among MS patients. People thought that it kind of brought on exacerbations and that the MS patient should just take it easy. But research now shows that doing resistance exercise about 3 times a week can actually reduce fatigue. It increases endurance, increases our speed and strength, and overall the functioning of MS patients improves when they do this exercise. If you think about it too, if you have muscle tone already, simple things like lifting groceries or lifting your baby, it's going to take less energy because you're strong to begin with. Mm-hmm. You might want to consult a physical therapist, if it's been tough for you to find a program that works. I think it's also important that we not compare our new physical activities to how we used to be able to do things. Some of us used to be runners, and maybe we can't do that any longer, but it doesn't mean that what we're doing, isn't helpful. Another issue that comes up for MS patients around fatigue is, around exercise, is that we get overheated, and for many folks with MS, heat is a real no-no. It can be an energy drainer. So, you may want to try going in the pool instead, or exercising in an air-conditioned environment. And I also want to take an opportunity to mention that MSAA has a wonderful cooling product program where they'll actually provide free of charge cooling products like cooling vests and the cooling things that you can put on your collars. Exactly. So there are a lot of solutions there. It shouldn't be something that keeps you from exercising.
Well, that's good to know, because people just need to look for options that work for them.
Right.
Now, family members often want to know how to help their loved ones with MS. Is there anything family members can do to actually help the patients manage their fatigue?
Well, that's a great question, and I do think that family members can play a really important role. And oftentimes, family members feel very helpless. So family members, here is a way that you can actually do something. I find that in my own relationship, my husband is a real buffer for me between overdoing things and getting exhausted. Sometimes when I'm kind of overlooking the signs, he'll point out to me, "You've done enough, you need to rest," or "You look like you're wiped out." And this is really helpful. Sometimes it's annoying, but I feel like he's nagging, but he's doing it because he loves me. And I think what you want to do is help your family members really get sensitive to what your signals are. Talk to them about, when you've reached your limit, and you need to let them know. Some ways of doing that could, again, be a rating scale. I know one woman who would put on her refrigerator a chart of kind of where she felt, if she was exhausted, if she had energy, what have you, so that when her family came home at the end of the day, they could look at that chart and they'd know, okay, maybe I need to do more to help out with dinner. But the reason she liked doing this chart is because she didn't want to feel like she was always saying that she was tired or be perceived as being complaining. And so this was a way she could get her message across without, feeling that way. And I thought that was very clever. Another issue is, you can delegate the more taxing chores to family members. For instance, if carrying the laundry up and down the stairs is too much for you, you may have your teenager do that, and you take on doing the folding because it's not something that's as physically demanding. It's sometimes hard to convince family members, well, why should they pitch in and do more? And it sounds like it should be a no-brainer, but if you can point out to them, look, if you help mom out, I'm going to have more energy, I'm going to be nicer to be around, I won't be so frustrated or irritated with you, and there are benefits, For a husband, you might be a little more frisky, with him if you're not exhausted. So there's a payoff for everybody. But ultimately, just like everything else we've been talking about, it is going to fall on our shoulders to really communicate how we're doing, how we're feeling, how much energy we have, and how much help we need.
Those are some excellent ways that family and friends can help out. Where else can the MS patient turn for support?
Well, they can talk to their physician about using occupational therapy or physical therapy. These are professionals who are trained to really help us get the most out of our energy every day. An occupational therapist can help us to learn ways that we can do daily activities that will minimize effort, such as if you're chopping vegetables for dinner, sit down while you're doing it rather than standing, right? And then for physical therapy, we learn how to use our body in ways that take up less, energy and make us move more efficiently. But either one of these sort of helpful people, they require a prescription, so your doctor has to make that referral, and the only way they'll know that you need that is if you ask them for it.
Those are some great strategies. So any last thoughts on managing fatigue?
I think my final thought on this is that we have to talk about acceptance. Really, it takes this acceptance that, yes, we do have limitations. Yes, we do have to honor what our body is telling us. We've got to stop comparing ourselves to who we used to be and what we used to be able to do, and really honor where we are now. It's critical to give ourselves permission to rest when we need to rest and to take care of ourselves. And in the long run, everyone benefits from this approach to wellness.
It's great advice for all of us. Thank you so much for joining us.
Thank you, Danny.
This concludes our program, A Closer Look at Managing MS Fatigue. On behalf of MSAA, I want to thank Allison Shaddy for providing us with a better understanding of this important topic, and EMD Serrano and Pfizer for their support of this program.